Hi everyone, this is Janet Hale at the Rock Island County Health Department. It is 3:30 p.m. on November 19th. Thank you for joining us. Today we have with us Nita Ludwig, the administrator of the Rock Island County Health Department, Ed Rivers, the director of the Scott County Health Department, and then we also have a speaker who is Jeff Deppe, who is a member of the Rock Island County Board, who will tell you about his very serious case of COVID that required long-term hospitalization and convalescent plasma. And then we also have Pete Lux of the Mississippi Valley Regional Blood Center, and he is going to talk about their convalescent plasma program. Nita, let's start off with Rock Island County numbers, please.
Sure. Today we have 116 new COVID-19 cases, and that brings our total to 7,249 total cases. Today, unfortunately, we are reporting 3 deaths in our county. A man in his 80s who was in long-term care, and 2 women in their 70s. Both of those women had been hospitalized. And our deepest sympathies to the family and friends of all these individuals who have passed away. The deaths now for Rock Island County are at 123, and 69 people are currently hospitalized in the county with COVID-19. Thank you.
In Scott County this afternoon, the number of cases is 9,412, and our number of deaths is 66. This means there have been 5 deaths since our Tuesday press briefing and 12 in the past week. We're heartbroken that we've lost so many members of our community in such a short period of time, and our sympathies go out to their family and friends.
Okay, thank you both Ed and Nita for the numbers for our community at this point. Next, we will hear from Jeff, who is a member of the Rock Island County Board and an individual who had a severe case of COVID-19, and he is here to share our story with us as well as provide some thoughtful reminders to members of our community. So Jeff, thank you so much for joining us. We can let you go ahead and share your story, so please just unmute yourself on your screen. Thank you.
Hello, everybody. My name is Jeff Deppe. My story with catching COVID was I normally wore a mask, but when I got to work, I work with the same 5 or 6 people. So when we get into the building that was locked, we'd take our mask off. The only other place I went where I would take my mask off when I'd be out in public would be down at the county for our budget meeting. We would take our mask off because we all know each other. We'd be 6 foot apart most of the time, but we still should have left. I still should have left my mask on. So everybody at my work had tested negative for the COVID after I came down with the symptoms. I can't say that for the budget because there's 20, 30 people in there I don't know. But for myself, I had left the budget meeting and I started feeling tired. And for the next 3 or 4 days, I just felt tired like I'd ran a marathon. So I'd stayed home and just had a blanket and watched movies. And on Sunday, I started to develop a fever and a cough. So on Sunday, with the cough, because I'm an asthmatic, I normally do albuterol. And if I have to do albuterol 3 times in a day, I'm supposed to call my doctor. So about 5 o'clock in the morning, I had called my doctor and she just said, let's just go to the ER, make sure everything's okay. You're probably just having an asthma attack, but let's go down there because you've hit your 3 for the day. So I go down to Trinity on 7th Street and I walk in and just said, hey, I talked to my doctor. We think I'm having problems with my breathing, with my asthma. So she takes my license and says, yeah, you're in the system. A doctor walks up and shoots me with a temperature gun. It was 103.8. And he grabbed me by the underarm and says, you got bigger problems than asthma. And that began my trip into the ER where they started doing a checklist of, was I in other hazards where my body could have got poisoned or something? So they started taking a lot of blood and just trying to rule stuff out. Somewhere in the middle of that, a man walks in and said, yes, he did test positive for COVID. And then they asked me my family history of blood clots. And I said, yes, my grandma and grandpa and a couple of my uncles have had blood clots. So they put me in a machine that spins in circles and looks at your lungs for blood clots. And then and they said that that was clear. And then I was back in the room and they're doing more testing, and a lady walked in and says, "Do you have a family's history of heart attacks?" I said, "No, my family does not have a family history of heart attacks." She goes, "Well, right now your heart is bleeding into your bloodstream and we can see that. You've had a couple of heart attacks. Did you know that?" And I said, "No, I did not know that." So from there, they started treating me for heart attacks and the COVID. And they started they were putting IVs on me. I'm not sure what everything they were doing. And then they transferred me up to the 4th floor COVID wing in Rock Island through an ambulance. After more testing, they ruled out like poisons and things like that. So we get there. One of the issues I was having, I was coughing so much that my ribs hurt, like somebody was punching them. So we were trying to get that under control. At the same time, they'd taken my temperature again, and don't quote this, but I want to say it was like 105, and they were getting very, very nervous. If we could not get the coughing under control and keep the fever, they were talking about icing me down and then cutting my throat and putting me under with a breathing, I can't remember the ventilator. But I wasn't a fan of that. The idea of being put under kind of made me nervous, and they called my mom and said something to her. So he asked me, the infectious disease doctor said, "Well, we have experimental treatments. Would you be willing you could do up to 2 bags of plasma and up to 5 bags of remdesivir?" And I said, "Yes, I'd be willing to try that." He goes, "Now you got to understand this is experimental," and he had mentioned that not everybody gets it. So we signed a piece of paper acknowledging that I want to be in the lottery for it and that I want to try it. And for me, I looked over at this doctor, and at the time they were giving me medicines for my heart and help with the coughing and stuff. So I just looked over and says, "Hey, am I going to be okay?" And his exact words is, "I can't tell you that, but I'm going to use medical science. That's what I have." And that it was a real eye-opener to me, because normally a doctor's like, "Oh, I've done this 1,000 times. I know exactly what's going to happen. You'll be fine." But when he said, "I can't tell you that, I'm going to use medical science," it's an eye-opener. So from there, I signed the paperwork. I vaguely remember like 1 or 2. We did the first bag of plasma. And for me, what it felt like when it went into my body is like when your arm falls asleep and it tingles. That's what I thought I was feeling through my body. I don't know if everybody gets that, but that's just something I noticed. And then we did the bag of remdesivir and then followed it with a half hour of saline, because they want you to wash the lines out to make sure there's nothing left. I noticed that my infectious disease doctor showed up for supper, and that's not normal. And my supper was all fruit. So I started eating, and I was eating pineapple, and I was squinting because it's like bitter. And he grabbed my arm and says, "You're going to be all right, kid. You're going to be okay," because I could taste it. I did not realize I didn't have my taste back until he pointed it out, that I was grimacing from the fruits, the strawberries and the pineapples and stuff. And I was like, I admit it, I'm not a person that cries, but I started crying. I was like, "You know what, God, we're going to get out of here." So we had to do 4 more days of the remdesivir, because you do 1 bag a day. And then the problem I had is we were still working on my heart. They scoped it with I call it a TV thing where they can see your heart, but they scoped it to infinity, and there was no permanent damage to the outside, and that was a blessing. So the lady who works in the heart says, "We can fix this, and we can do it through medicine." And I was very thankful for that. From there, I spent, because I was on oxygen the whole time, trying to get me off oxygen. But the problem was if I got up and go to the bathroom or to clean myself up with wash rags and stuff, my oxygen level would drop down to 80%, and that's not good, from 92 to 94. Because I had a thing on my finger to tell me my carbon dioxide oxygen levels. So from there, And I was also fighting fatigue. And on day like 14, I got to leave the hospital. We went home and I had outside nursing for the next 14 days where 3 times a day we would check my weight, my pulse, my temperature, and I'm trying to remember if there was something else. And then they would come visit once a day just to see if I was all right. And just to make sure I'm eating and things like that. So eventually I was able to get off the outside nursing. The long-term effects for me are if I go to the county building and I walk up the steps, because I think the marble floors in the building are beautiful. I'm not a big elevator guy. I have to stop at each landing because I'm out of breath. I get winded easily. I'm still taking a pill for a cough that helps dry my lungs off because I have a redundant cough, and that's been since September 28th. We're still taking medicine for my heart. And from there, I talk about, since September 28th, I've lost 65 pounds. Yesterday or Tuesday, I went and got tested because I truly believe if it wasn't for the plasma and the 5 bags of Redismer, I wouldn't be here. So I have to give back. If I have the stuff in my body to where I can give plasma, I'm going to do it. I really feel I need to. And every day I get stronger. The cough gets less and less. If I try to read emails or if I try to focus too long, my eyes get dizzy and I have to take a minute back and then I'm okay. And it's just something that has happened. I think the hard part is my mind thinks I'm okay, but the body is not ready to catch up. I'm still fighting that. Something I am getting better at since the COVID, and I've talked to other people who had it. On my Facebook, what I said is, if you have COVID and you want to talk to somebody, talk to me, because I'll tell you what I went through and we can get through it. Because in a COVID unit, you're in a room by yourself that's 15 by 20 with just a bathroom and the doors are shut. Everybody's in a PAPR, they got a mask on, they got a face shield, the plastic gear. I'm telling you, it's a very lonely place. And it was the people on Messenger and Facebook and texting me saying, hey, you're going to get through this. That helps you get your mind from wandering, because I'm telling you, that's a lonely, lonely place. The one day I go, can we just leave the door open so I can feel like there's life going on? She goes, no, the door has to stay shut because of the COVID. And that's the reality of it when you get there. One of the things where I was going with this is, sometimes I'll wake up at 2 in the morning. Sometimes I'll wake up at 4 or 3. And when I wake up, I feel like I had 6 cups of coffee and I can't not get back to sleep. So I go to bed around 7 so I can get enough sleep so I can go to work. So I'm not too fatigued. Talking to other people who have COVID, they've had the same thing, where they just wake up really early in the morning and you will not get back. So you might as well turn on the news or something because you're not going back to sleep. And the other side effect was my mom lives with me. I have like 4 or 5 bedrooms, and she was like, well, I'm gonna get an apartment. I said, Mom, just go ahead and move in with me. You don't need to pay rent somewhere. Well, she was taking care of me on Saturday and Sunday, and I gave her the COVID. We know that. Everybody she worked with tested negative. She still has the cough to this day also. But she's doing okay. But her big thing is she has the cough and she's in her 80s. And that's just about everything, unless I forgot something from my story. Thank you.
Thank you so much.
Thanks for telling your story, Jeff. This is Janet. I wanted to quickly just have you reiterate your hospital stay, how long it was, and when you went in and when you were discharged.
I went in, let me look at my phone. The budget meeting where I'm almost positive I got it was September 24th. I went to the doctor on the 28th. I got out 14 days later. That's how long I was there. And I truly believe it was the plasma and the Redismer that actually speeded it up. Because from that point that I took that first bag and the Redismer, the temperature dropped drastically. It dropped to like 101 and 99 degrees. And I'm like, is that good? And they're like, that's beautiful. Because they were taking my blood every 4 hours, and they were taking my temperature, I want to say every 4, because I had to take cough syrup to try to stop the coughing so my ribs would stop hurting.
Thank you.
And
Okay, Brooke.
I had 14 days with home nursing too. And then, oh, something I forgot. I had to take it took me 4 tests to finally get a negative. And when I talked to the infectious disease doctor at Trinity, his suspicion is because they put the plasma in. He goes, I didn't release you with COVID. I'm telling you that. You were okay to go home, but it's not uncommon to have a bunch of positive tests even though you don't have it. I don't know if that's because of the plasma and putting it in my body, but it took me 4 tests to finally get a negative so I could go back to work.
Thank you, Jeff. We're so grateful that you shared that story, and your message about the convalescent plasma is great, and it really brings us into the next person that we have on the call here. So next I'm going to bring Pete Lux in from the Mississippi Valley Regional Blood Center, and that's exactly what he's going to talk about and the need for that right now in our community. So please go ahead, Pete.
Thank you. Jeff, thank you for sharing your story. I think it really puts a face to this situation that we're all dealing with, the pandemic and the results from it, and that hearing that you were able to recover and you really feel like the plasma and the remdesivir really had a big part to do with that. I think it really gives substance to what we're doing here at the Blood Center. So as Director of Donor Services, I'm responsible for ensuring that the product is collected and appropriately and safely from donors and potential donors who have recovered. So when you're fully recovered, we look forward to you coming in and helping other patients recover from what you've been through. But I do want to talk about how throughout this pandemic, the hospital needs for CCP have remained pretty steady until about 5 weeks ago. And those are our service hospitals that we supply within our territory. We were staying in the mid 100, like 150 doses a week. And about 4 weeks ago, we spiked up to well over 300. And last week, we shipped out 542 individual doses. So that really has been quite an uptick in what we've sent out. And we expect to see that need continue at that rate. But we are not seeing enough convalescent donors coming back to donate. Last week, we had 43 donors present who gave a successful procedure. We get about 3 to 4 doses from each donor. So that's about 150, 175 doses, but that's not enough to meet the need from the hospitals. And we are working with Operation Warp Speed and some other initiatives to get more donors to come in and make sure that we can help with that supply. We're already seeing the fruits of that labor this week. In the past 4 days, we've had, or 3 days actually, Monday, Tuesday, Wednesday, we've had 53 donors present just in those first 3 days. So we're already seeing an impact from that. We have been able to, until recently, get COVID or convalescent plasma from other blood centers where they've collected it. But that supply has been depleted as well. And we're not able to import those from other blood centers. So we are having patients on waiting list for this product. So we want to make sure that we're able to meet those needs. And currently, without the support of more recovered patients coming forward, we're not going to be able to do that. And as of right now, there are 2 vaccines that are headed down for FDA approval, but they are not yet approved. And really, there's no curative approved treatment for COVID at this time. Right now, even like you said, Jeff, convalescent plasma has not necessarily been vetted out completely for the efficacy of that treatment. So we want to make sure we continue monitoring patients to see how they recover. But we are working with other blood centers and public health departments to do everything that we can to make sure that we get in contact with people who have recovered. We have our website, bloodcenter.org, where you can have your provider refer you if you're recovered. If you've had a positive test, you can submit your own self-referral, and we will contact you about getting you in and setting up a time for an appointment. But it's very important that we kind of target those potential donors who have recovered. And recovery is 28 days after your last symptom resolves. So we want to make sure that we reach that forefront as well. Additionally, if you did receive convalescent plasma, that is a 3-month deferral there. So we have to wait till that time elapses. But with your recovery and the date that you got it and the symptoms that you may be currently having, they may fall pretty much at the same time. So we have to watch out for those two things. Recently, the FDA did update many of the criteria that were 1-year deferrals, such as travel to malaria area and other reasons for deferral. They went from 12 to 3 months. So if you have been deferred in the past, you want to make sure that you come forward and check with us on our website, bloodcenter.org. There's a page where you can input your information and ask your question about deferrals. The biggest one that they changed that I think is having the most impact is travel and staying in Europe at military bases, the exposure to Creutzfeldt-Jakob disease. If you were in the military and stayed at a base in Europe for 6 months or more, that was an indefinite deferral. That deferral has now been lifted. So we're working with our computer system to contact, figure out who those donors are that have that deferral code, and then reach out to them and let them know that they're no longer deferred. If you are part of that group that was once deferred for that, please go to our website, bloodcenter.org, and you can input your information, and we'll make sure that deferral is removed from your account so that you can come in and donate, or we'll get the additional information that we need to proceed with taking that deferral off if we can. So really, we need donors, and we're really doing everything we can to get them.
Thank you, Pete, for sharing that information. We're glad we're able to have you on and share that important message. We do have a couple of questions, some of which you did answer. The first question, it goes back to Jeff. How has this illness changed the way you think about COVID policies?
For myself, I think when I drive around town and I see people in mask groups without a mask, I get worried. For myself, even going through a drive-through now, I wear my mask. And because I'm worried that I could get it again. I'm more worried about, one of the things they told me to worry about is because my lungs are weakened, about getting pneumonia or flu, because that could put me right back in there. I think that I hear so many people say the masks don't work. They do work. I think they do work. And if anything, we should be looking out for each other, because I don't want to be the person to give it to my best friend or my grandma and grandpa and people like that. It could be more acceptable. So if it takes 5 minutes to put a mask on, just do it. And then wash your hands. And if they say don't go out in public, don't. Just for a little while. I think it's going to save lives.
Thank you. I'm just going through a couple of these because I think a couple were answered by the Mississippi Valley Blood Center in the chat. Pete, how are patients doing who've received the convalescent plasma? Do you receive data back on that, or do you have any anecdotal information you can share?
So as the blood provider, we don't necessarily get the information back on how donors or patients responded to our products. Dr. Katz may be able to speak to that a little more than I can, but I wouldn't necessarily have access to that unless it was in a larger study. And then I think there's another question there.
Yes, Dr. Katz, do you want to say anything in connection to that about the convalescent plasma success?
Well, the evidence is evolving as we speak, and the best evidence available at this point says if it's going to be an effective treatment, it needs to be administered as early as possible, preferably within the first 2 to 3 days after symptoms start, and it needs to come from a donor with very high levels of the antibody that we're interested in. The people who tend to have high antibody levels are the people who got sickest, like Jeff. People who wound up in the hospital, wound up in intensive care. So as those who are really sick recover, we really want them to contact the center and talk to us about donating. I suspect that as the next 8 to 16 weeks go by, we'll have much better evidence about how effective convalescent plasma.
Thank you. Pete, I think the other question was, are the 43 plasma donors from all over your service area? And maybe you can just give us a general information on what that service area is.
Yeah, those are from our service area that we do for collections. So we cover, of course, the Quad Cities, all the way up to Madison, Wisconsin, over to, and that includes the Dubuque area, Cedar Rapids, Ottumwa, and farther west of there, down all the way down to St. Louis, Springfield, Illinois, and Champaign-Urbana. So it's about 78,000 square miles, and we cover quite a bit of territory. We have 20 donor centers where we can collect that convalescent plasma from donors patients who have recovered. We will also work with someone who may not live near a donor center. Don't think that that's a reason why you can't come and donate. We have blood drives throughout our territory, and we will work with you to schedule that person at a blood drive. Right now in Madison, Wisconsin, we recently started supplying, well, it's been about a year, the hospital up there. We don't have a donor center yet, so every Tuesday we're going up there for convalescent plasma blood drives, and we can do that pretty much anywhere. It may take a couple of days to figure it out, or a week or so, but we will work with that potential donor to get them to come in.
And Pete, can you once again just explain how somebody interested in donating convalescent plasma who's potentially recovered, how they can contact the center?
Sure. There are multiple ways. If you go to bloodcenter.org, we have a pop-up on the very first thing that says, if you want to give convalescent plasma, click here. It'll take you right to the form to either be a self-referral, or if your provider is, your care provider is providing that information, they can do it on that website as well. There's also an 800 number that I can't recall right now. Maybe Curry can text it to me, and we can do it through the phone as well. The key thing is right now we want to make sure that you have that you've had a positive test, and as Dr. Katz said, the symptoms, you know, the stronger that your symptoms are, the more antibodies you're more likely to have. So.
And then Pete, I'll ask, since you're on here, if you can just give us general information on if there's a need right now just for traditional blood donors.
Yes, I'm sorry I left that part out. That was on my list of things to talk about. Yes, we still do continue to need blood from volunteer donors to help patients with elective surgeries, you know, vehicle accidents, shooting accidents, whatever they may be. Those activities still continue, and we still continue to supply blood to all of our hospitals and beyond that who need blood cancer treatments. Anything that requires chronic use of blood, that hasn't stopped because of the pandemic. What has stopped is our ability to have blood drives at high schools, where we, you know, during this time of the season, about 30% of our blood comes from high schools and colleges. Well, COVID-19 pandemic has really placed an obstacle in front of us that has been very challenging. The recruitment team has really worked with many of these groups to still have a high school blood drive, but maybe at the community center, or, you know, work with the high school and make sure they understand all the health and safety measures that we have in place to allow us to have a smaller blood drive with much more control. Some of the other things that we've done during the pandemic to make sure donors remain safe is appointments only. So if you are a volunteer donor and you want to come donate, we won't have a mass of walk-ins come in because we can't control that. You know, Jeff mentioned that a couple of times in his story about seeing people together. Well, we really try to limit the number of people we have at any given time. On a bus, we recently lowered the capacity of how many donors we would have on there at once. Prior to COVID, we would let 20 people be on there and nobody thought a thing of it. So now we really limit it so we can maintain social distancing, and all staff and donors are required to wear masks at all times. So that has helped in preventing the spread at our organization. We've also extra cleaning between donors and wiping down the entire room after we screen a donor. Doing it so much that we have degraded the light switches, have had to be replaced from using so much cleaner on them. So it's beginning to take a toll on some of our equipment, but we want to make sure that we remain safe and we keep donors and staff safe. Thank you, Amanda, for supplying that information.
Well, thank you, Jeff, Pete. We're very grateful that you joined us today and shared your important messages. We will go ahead and conclude. I don't see any additional questions. Again, the recording will be posted on both of the health department's websites as well as on social media. We're grateful for our news partners for sharing this information, as well as our continued public health messaging as we're coming into the holiday season beginning this next week. Thank you all for your time, and we hope you have a good afternoon.
Thank you.
Thank you.